So welcome back. We're going to talk today about testicular atrophy. So this is the shrinkage or the reduction in size of both one or both testes, and it's accompanied often by loss of function. The condition can affect testosterone production and sperm development, and it can lead to fertility issues and hormonal imbalances. So early recognition and management are pretty important to reversing or mitigating its effects. And now we all cross our legs and hope that it's not going to happen to us. It can happen for a variety of reasons. There can be hormonal imbalances such as low testosterone levels, imbalances in hormones such as FSH or LH. Infections like mumps and orchitis can cause inflammation in the testes. Varicocele, so enlarged veins in the scrotum, can impair blood flow and there as a result the testicles atrophy. There can be trauma and injury which has a direct impact on the testicles. Lifestyle factors, so prolonged use of anabolic steroids. So these are things that make your muscles bigger but make your testes smaller. Excessive use of alcohol or drugs can have an impact. And then chronic stress or malnutrition can also cause your testes to atrophy. Medical conditions that can cause this would be testicular torsion, which is a twisting of the testicle and cuts off the blood supply. It's very painful. And then prolonged exposure to heat, so frequent hot tubs or saunas can also have an impact on your testes and your sperm count. If you've gone through radiation or chemotherapy, then one of the things to be aware of is a side effect can be testicular atrophy. And then certain medications such as hormone therapy or antidepressants can also cause this to be a problem. Now, what are the symptoms? So you have a decrease in testicular size. You can have a reduced sex drive. You can suffer from infertility or reduced sperm production. You can suffer fatigue or loss of muscle mass. There can be pain and there can be discomfort in the scrotum. And you might find that you'll develop breast tissue. So this is gynecomastia if there is a severe hormonal imbalance going on. Now, conventional treatment, normally men will be given HRT, testosterone therapy, for men with low levels of the hormone. You might be offered surgery to correct conditions like the varicoceles or the testicular torsions. Antibiotics for antiviral medications such as mumps and bacterial epididymitis might be offered, and then a lifestyle modification to try and come off things like the anabolic steroids or anything that you have been taking to build up muscle mass. Now, when it comes to natural and functional approaches, there's a couple of herbs that we would really recommend for this. So ashwagandha promotes hormone balance if stress was there, but it also improves testosterone production and sperm motility. Tribulus terrestrius is a herb that increases the amount of blood flow and enhances reproductive function. It's also a boost to testosterone levels. Panax ginseng improves circulation and it supports hormonal health. Sol palmetto aids in reducing inflammation and promoting testicular function. And then there's a number of supplements that can be recommended. So zinc-rich foods such as pumpkin seeds, oysters, legumes to help support sperm and testosterone production. Vitamin D found in fatty fish and fortified foods and sunlight. Antioxidants such as food like berries, nuts, leafy greens can all reduce oxidative stress on the testicles. Now, tips to prevent testicular atrophy. Wear protective gear during sports or physical activities to prevent any trauma coming to the testes. Avoid prolonged heat exposure, so limit your time in the sauna and the hot tubs or environments with excessive heat. Now, what I would say to you is if you're past the age of fertility, the benefit of saunas far outweighs the negatives of saunas. So what you want to do is ensure that you're sitting naked and that you're not trapping a whole pile of heat in and around the testes and that the scrotum's able to descend fully. That's better than not having a sauna at all. Hot tubs though, however, puts heat directly on the testicles and is something we're a little bit more cautious of. Limit steroid use, so avoid anabolic steroids and reduce the amount of alcohol or recreational drugs that you might be taking, and maintain regular checkups, so monitor your hormone levels and testicular health with your healthcare provider. Now, if you notice a sudden or noticeable shrinkage in testicle size, if there's any persistent pain or discomfort in the scrotum, if there's any symptoms of hormonal imbalance such as fatigue, low libido, or breast tissue development, if there's any infertility concerns or difficulty conceiving, then please do get seen. Don't sit on this or wait. Hopefully you find that useful. If you've any questions, do come back to me, and I'll certainly answer them as best I can.